In the medical community, patient-centered medical home and ACO initiatives have brought preventative health for communities to the forefront. The Healthcare Insurance Portability and Accountability Act, better known of course as HIPAA, and more recently the Patient Protection and Affordable Care Act, better known as the ACA, help employers to encourage healthy behaviors among employees by providing specific language. On May 29, 2013, the final regulations were released regarding wellness programs under the ACA. While the ACA prohibits discrimination against health plan participants and beneficiaries in eligibility, benefits, or premiums based on the participant's health, it provides an exception for worksite wellness programs that allow employers to offer incentives or rewards, including premium discounts, for employees who adhere to health promotion and disease prevention programs. Generally speaking, the ACA adopts the existing HIPAA non-discrimination requirements for health contingent wellness programs and increases the maximum reward that an employer can offer, while clarifying and reorganizing the existing rules. Specifically, the final regulations formally adopts HIPAA's non-discrimination rules for health contingent wellness programs, such as giving individuals an opportunity to qualify for the reward once a year, and providing a reasonable alternative for individuals with health conditions. It increases the maximum percentage of annual employee-only coverage that can be used as a wellness incentive from 20% to 30%, or up to 50% if the program is designed to prevent or reduce tobacco use. It also establishes two categories for health contingent wellness programs: activity-only wellness programs and outcomes-based wellness programs. So what does all this mean in real terms? If a program is offered to all similarly situated individuals and rewards are based on participation only, so not tied to a specific health factor like BMI or cholesterol, or there's no rewards at all, the program is already in compliance with non-discrimination standards. You may remember I mentioned before that the vast majority of existing wellness programs fall into this category. The two clients that I mentioned, Sun Automation and H&M Bay, both have programs that fall into this category. It includes everything from a gym reimbursement program to a reward for simply participating in biometric screenings and a health risk assessment, to programs that allow employees to earn points for participation in various free events, and then points are redeemed for rewards. Health contingent programs require an employee to meet a standard related to a health factor in order to earn a reward, either through an activity, such as a fitness class, or a health outcome, such as not smoking or having low cholesterol. These types of programs are subject to additional standards. I'm going to go ahead and put them all up at the same time. Employees must be given an opportunity at least once a year to qualify for the reward. Open enrollment tends to be the most common time of year. Rewards must be within the guidelines established for health insurance plans. The program must be reasonably designed to promote health. In other words, and this is important, the program can't just be a mere exchange of a reward for a screening result or an answer on an HRA. It needs to be part of a larger program designed to promote health and prevent disease. The program must be available for all similarly situated individuals. So, for instance, all employees on the health plan, or all employees in general. Lastly, whether activity-based or outcomes-based, a program must offer reasonable alternatives to earn a reward. So while the initial standard for a reward may be not using tobacco, a reasonable alternative could be completion of a free tobacco cessation program, regardless of whether the individual actually quit smoking. The final regulations also include new details on these alternative standards. Health contingent programs can be highly effective when they're designed to meet this criteria and executed well. For many clients, this type of program is the natural evolution from a more basic wellness program. Regardless of whether your organization is data-driven, culturally driven, or a combination of the two, whether your budget for the wellness program is significant or shoestring, whether your ideal program is health contingent or participatory. There are best practices for worksite wellness programs that can be pulled from all of this, and common barriers that companies face when designing and implementing a program. Luckily, there's also plenty of resources.